kick it off.
Just go ahead and get started.
Mhm.
Perfect. And I know I'll have a couple of our staff jumping in just that are a little bit newer that just like to jump in on trainings to kind of use. So they'll probably be coming in here in a few minutes as well. But yeah, we can go ahead and get started. So and because it is a small group, if you do have questions, do please feel free to just kind of interrupt. Let me know what questions that you have, but we will just kind of go through the whole spiel of getting a family added, getting visits, looking at reporting, ways that you can audit some of that reporting as well. So we'll just kind of jump off. The first thing, logging in, just that I want to draw your attention to that across the top here, you may have some different notifications and alert news, release notes, anything that we've recently released will be listed here. So just kind of make sure that you read through those. Those are kind of our best way of communicating with you all. Any new features, anything like that. So you can read through those, close that out by clicking that little X. If you ever want to go back to one of those active notifications, over here on the left-hand side, you can click on active notifications and be able to read through all of those. So just so you know where to find that if you ever want to go back and take a look at that. So active notifications on the left-hand side. On your homepage here, you have your upcoming contacts. So anything scheduled for the next 2 to 4 weeks, depending on how you have that set up. You can go ahead and see those listed there. For parent educators, they will see reminders. Most of those reminders, because they are for the parent educator, as the admin, you're not going to see those as much just because that list could get very, very long. So we don't show those for the admin, but the parent educators are going to see if they have, a reminder on an upcoming screening, assessment, something like that. And then upcoming child birthdays. So that's just kind of your welcome page. As administrators, some other things that I kind of want to draw your attention to over on the left-hand side. We have some different things here too. We have home visitor caseloads. So you can kind of see how many families, what everybody's caseload kind of looks like. If you click this little arrow, that will give you the drop down of the families. The numbers at the top here are the numbers of families and the number of children. So we have, for Cinderella, you have 11 families with 16 children. So you'll see those families kind of listed for each child. So that's what that will look like. If you need to make a change to a caseload, if we need to reassign a family, something like that, you would do that by clicking this pencil icon. And from here, we can update to reassign or give additional access. Additional access would be if 2 parent educators need access to 1 family. So you can give an additional access, or you can reassign. So if we have one of Cinderella's families, it's going to go to Keanu Reeves. I would select the family and then I can say save. It's going to ask me to confirm. Yes, I'm reassigning these families to Keanu Reeves. Confirm. So you can do some of that through the caseload. So just as kind of an FYI, back to the home page in the upper right-hand or left-hand corner. You also have some staff events, some supervision. We're going to talk about that in a little bit. Just we'll go in a little bit deeper to kind of some of these staff events and supervision. So I'm not going to cover that right now, but just know there's a shortcut way to get there. Okay. So the first thing we're going to do is talk about entering a new family. We're going to go to the Families tab. You'll see across the top here, we have families, guardians, children. Then you also have a home visitor, calendar, report, and supports. Setup. Steve, I believe you are the main administrator for the account, correct?
That's correct.
Yeah, so you have all these setup options, which we can talk about too, as we're kind of going through some of these things, like talking about your screenings, your assessments, making sure that you have the right things turned on. So we can look at that as well.
I do have a question about that. So if whoever we choose as the admin, I just want to make sure that the supervisors have all the functionality that they will need to be able to supervise and monitor the families. Is there anything in the admin account that the supervisor needs?
So not necessarily some of these setup preferences. All of these preferences are just turning on or off different fields. So depending who might want to see that or need that, you could give them the option to see some of these. But the biggest thing for you is going to be under user management. So this is how you would add, your parent educators, any helper admin. So this little plus icon to the right, that will allow you to give those additional permissions. So the biggest one is making sure that they have the supervision records checked. And then again, any of these kind of additional setup options are completely optional. But definitely the biggest one is creating supervision records, and then kind of looking to see if there's any others, but that would be the big one.
But I can add a permission for the managers to be able to do user management?
Yep.
Okay, that's what I thought. Okay.
Yeah.
I just want to make sure that I wasn't kind of bogarting.
That would be down here.
Yeah.
Yep.
Okay, that's great.
Yeah. Perfect. So yeah, as long as they have that full access and then the supervision, then you can kind of decide what else you want them to see over here. Perfect. All right, so we're going to start on the Families tab. We're going to add a new family. Over on the left-hand side, we have a new family link. We're going to click on that. That will open up kind of to add the primary guardian. So that's who we'll start with. Primary guardian is typically the guardian you're going to be doing the most visits with. You can add as many guardians to the family that you would like to. So if there are maybe some additional, maybe grandma lives in the home and she's also going to be participating, you could list her here. Parents as Teachers does kind of, their guidance on this is to only add guardians that have basically assigned participation agreements. So if you have two parents, maybe mom is going to be doing the visits, dad is not going to participate, he's not going to be involved in anything with the visits, then you wouldn't necessarily add him as a guardian. You could add him as another family member, which I'll show you in a minute. But to kind of begin, we're going to go with our primary guardian. So family name would just be the last name of the family. If the parent has a different last name than the child, you can decide what the family name makes sense to you. So if it makes more sense to have the child's last name listed here, that is fine. Just know that when you go to this drop down, it's going to be alphabetized by this family name. So if there are multiple last names within the family, just list the one that makes the most sense to you that you will remember. And then you can kind of go from there. So guardian first and last name, and then we have mailing address, street address, city, state, zip, county, phone, email, all of those things. They are all optional fields, but definitely highly recommended if you know them to get them entered. One thing about email. So by entering an email address, you do have the option within Visit Tracker to email families directly from Visit Tracker. The only thing is they do need to verify their email with us first. So when you enter a new family or a new guardian, you put in an email address, it will automatically send the family an email that just says on behalf of, you know, if Cinderella is sending this on behalf of Cinderella, your home visitor, she would like to be able to send you emails through Visit Tracker. Can you please verify your email? There is a link they need to click. They'll click the link, it verifies. And then as a parent educator, admin, whoever, we can email directly from here. That email will often go to junk, and it looks a little spammy, to be quite honest. So it's always a really good idea to let the family know ahead of time. Hey, you're going to be getting this email. It's not junk. It's not not spam. Please go ahead and click that link. That just allows us to send you email from our system. That is a feature that can be turned off as well. If it's not something you want to utilize, you can turn off so the family won't get those verification emails. So completely up to you, but just to know that does default to on, so they will be getting that email. Okay. So moving down, you have your community type, case level. So how often are you going to be visiting the family? And this does not determine visit frequency. So this is kind of the goal for the family. We're gonna meet with them twice a month. But when we go into demographics and we check off our strengths and stressors as defined by PAT, that is what will determine the visit frequency. So this could be different. Maybe you have a family that is overwhelmed. We can only fit in a monthly visit, but maybe they have 3 stressors. So according to parents as teachers, by definition, you should be seeing the family twice a month. But I have already spoken with this family. I know they're going to be monthly. And that's okay, but just know they're not going to meet the benchmark because the stressors dictate what visit frequency should be. So, we can say we're only going to see them monthly, but they will kind of be out of compliance based on PAT definition. But that's also why parents as teachers doesn't have 100% compliance on that they do give you some room within 75% of your families meet their visit frequency. So just know this case level is not what determines visit frequency. It's the number of stressors, which we'll talk about in a second. Site fund code. So this would be set up by you all as a program if you have different funding sources or different ways that you need to report on families. Every report we have in Visit Tracker has a site code filter. So if you do have a couple different funders that okay, this group of families I need to report on kind of separately from the rest of my families, I'm going to label them with a site code. If you don't have that, if all of your families just kind of fall into one bucket, you don't need to use the site code. You can just leave it as no code. It's really a program decision if you're needing that. Okay. Referral source. So who referred the family to your organization? You would select that there. Race, ethnicity, and primary language. Anything with the red star is a required field. So if you are getting this entered before meeting with the family, you can select a prefer not to report. And then once you have met the family, make sure that you come back and then select whatever race and ethnicity are reported by the family. This is a multi-select, so you can choose additional race if that is needed. Gender, date of birth, marital status, primary language. If there is a secondary language in the home, you can select that as well. And then moving down, we get into our service enrollment. So we do have a couple different options in when you're enrolling a family. So the first is are they enrolling in home visiting? So yes, right away, I already know this family is going to start home visits. I've got something scheduled. We're good to go. So I'm just going to say yes, we're going to enroll. Enrollment date, you really want this enrollment date to match the date of your first foundational visit. So if you have that on the calendar already, that's great. Go ahead and put in that date. If you don't, this date is very easy to change. So we can put today's date. Once I talk to the family, if I know my visit's going to be next week, we can change that enrollment date. So that's kind of easiest case scenario. We enroll right away. If we don't know, or if there is a wait list, so maybe all the caseloads are full, we're going to put this family on a wait list. So for right now, I'm going to say no, we're not enrolling. We are going to go to a wait list. So as of today, what is our priority? What is our reason? So you can kind of select that. And then they'll go to the wait list. Once we have room, then we can change this family to active. So as soon as we know, you can move that. The other option a lot of programs use would be recruit. So maybe the family has called in or somebody has referred the family to you. You want to get them in the system, but we're not quite sure yet. We don't know if they're going to enroll. So you can put them on a recruit status, and then that way we can contact the family. We can do some, follow up before getting them enrolled. So we're going to go ahead and say this family is a recruit. I'm going to backdate it just a little so that we can make them active again. I'm going to show you how to do that. So answer the rest of the questions. We're going to say create. And now that's created kind of our family file, so to speak. So we have our family, our primary guardian. We don't have a site code. We're going to see them monthly. We don't have a home visitor assigned yet because the home visitor gets assigned when we add a child. So that's why that'll be blank. But we have that they're a recruit. And then here is kind of our family members. So this is where you would add additional guardians. So if dad is going to participate, we've got mom already in here. Let's put dad in here, Eddie Jones. We can copy if the family lives together. You can just copy that address. It'll copy some of that information, put in their phone, email. Some of this information cannot be changed, so we would have to do that from the primary guardian because that's kind of a family level, so that's where that gets reported. Race and ethnicity are required, so we're going to fill that in. We're going to put our language, and then because the primary guardian is recruit, secondary guardian is also going to be recruit. So we have our second guardian added. We're going to go back to the family homepage over on the left. And now here we have our 2 guardians listed. So once we have guardians listed, next steps would be to add children. You have 2 options here. One is to add a child. One is to add prenatal. So if mom is pregnant, we would do a prenatal child, otherwise born child. So let's go ahead and get our child entered here. We're going to enter a date of birth. Let's go. And anywhere there's a date field, you can either use the calendar icon or you can type in. Either is fine. Relationship to the child, we're going to fill that in. And then we're going to say we have Allie Jones as our child. Immunizations, if you know them. And then here is where we're going to list our parent educator, gender, language, race and ethnicity. And then there is a question of, does this child have a diagnosed delayed disability or medical condition? If you select yes, it's going to give you some additional options to check off. And then if the child is already receiving some services, you can go ahead and check those off as well. Okay. Service enrollment is going to be same as the primary. So we're all in recruit. So we're going to say save and then back to our family homepage. And now we have mom, dad, child. We're going to go ahead and say mom is also pregnant. We're going to add a prenatal. So what is our due date for this child? Let's go October 15th. We need to select relationship again. And then for the name, we're just going to put baby. I'm going to put baby Jones. If the family knows the name, go ahead and put it in there. Otherwise, you can just say baby. Our home visitor gender is always going to be prenatal. So even if mom and dad know they're having a little boy, we're still just going to put prenatal. Okay. So not quite as much information is needed on that prenatal child. Go back to family home, and now you'll see we have all of our family members entered. So this is who all will be receiving services. If there is maybe another older child that is not going to receive services, maybe they're in first, second, third grade, you can add them down here under siblings, and then you have any additional household members as well can be added here. Going back to the prenatal baby. So once this prenatal baby is born, you will see this enter birth info link. By clicking that, that is going to allow me to change this baby, this prenatal baby, to a born child. So now you'll see the date of birth field is open, that primary language, the race, the ethnicity. We've got that delay or disability question that you can fill back in. You would just change the name. So just type over whatever that child was named. So you have that. So that is how a prenatal baby needs to be changed. Make sure that you're clicking that and not adding a new child. We want all that prenatal history to make sure it stays with this child. So enter birth info is how we change a prenatal baby to a born child. Okay. Any questions about entering family members?
I don't have any.
Oh, okay. So now let's go ahead and change this family from recruit to active. So what we're going to do here, I'm going to click on the service management button. That is going to bring me to kind of show me all the services this family has. So right now we're in recruit. We want to add a new home visiting service. I'm going to click the plus button in the upper right hand corner. This is going to allow me to add. So we're going to say we want to add a home visiting service. What is going to be our enrollment date? So what is that date of the first foundational visit? We're going to say today. What family members are going to be enrolling. So we're going to check off everybody. They're all going to participate. And then it's also going to ask me if we want to end the current service. So we want to end our recruit service because the family is just going to go from recruit straight into home visiting. And then we're going to say create. So this family is now active. So if we go back to our family homepage, you'll see we are now enrolled in home visiting services. So that is how we would enroll from either recruit, waitlist, anything you might have had as a kind of a pre-service into home visiting. Okay. If we get ready to exit the family once they are completed with services, there is a little exit icon here that would exit the entire family. So if I click on that, it's going to ask me their exit date, their status, which is just complete or not complete. And then you would select your exit reason. So by clicking this little square, that is going to exit the whole family. If I need to exit just an individual, we're going to click on the pencil icon. And then from here, you'll see each guardian and child has their own icon. So if maybe you had an older child that just the older child is exiting, but the family is staying active with the younger child, then we would just exit this one child, whatever our exit date, and then you could select the reason for that child to exit out. So that is how you would do an individual that you would be exiting. If the family needs to go inactive or on hold, maybe they're leaving for an extended period, so they're going to be gone for a month or two. If there's an illness, something like that, where the family needs to be inactive for a time. Parents as teachers, I think, defines an inactive period of 6 months or less. So if they're going to be gone for a year, then you would just exit them, re-enroll them when they come back. If it's going to be 6 months or less, then you can go ahead and say, okay, we're going to be inactive, and then select whatever reason. Once the family comes back, you would then reactivate. Okay. So that is kind of in a nutshell, just getting them entered, getting them active, exited, things like that. So next steps, once we get the family entered, we need to do some demographic information. So we're going to go to the left-hand side. We're going to click on demographic health. And then this is where you would do your strengths and stressors. So these are as defined by parents as teachers. This is what will determine your visit frequency. So depending on the number of stressors that are checked off, that will determine whether the family needs 1 visit per month or 2 visits per month. If you need a refresher, these definitions are straight from the PAT curriculum, so you can review those. And then just go ahead and check. You'll see that it is going to date stamp with our enrollment date. So check off whatever applies to the family, and then you can click Save. If a stressor comes along later, maybe the family has been with you for a couple years and a parent loses their job, they go into a low income status. So you can always adjust this date to the date that pertains to the family. So if it is something that comes along later, go ahead and check off the date that becomes a stressor. And then same thing, you can always end it. So maybe jobs change, job situations, they're no longer considered low income. You would put in an end date for that stressor. So based on the active number of stressors, you'll see that at the top, and it is only for the spots. So you will see we do have some other characteristics, maybe single parent, ESL, adoptive parent, any of those, you can go ahead and check them. Just know that they are not contributing. Sorry, that one is because I'm in a different state. Ignore that for a sec. So you'll see we still have 2 stressors. So even though this one was checked here, because we just have the 2 under our family strengths and stressors, we have 2. Okay. And really, the other family characteristics are dependent upon your organization. So if you look through some of these and you don't need to track that information, Steve, you can turn some of those off under your setup and then your demographic health. So family demographic fields, if there are any of these, you can uncheck them so that way they don't even show up. Some of them will always show, but you do have the option to turn some of those off, which is kind of nice. So just kind of showing the things that that your organization is interested in seeing. Okay. So that would be the big one. And then we have some additional family income, parent employment, parent education, housing, some of these different things. So for these, you have a plus button in the right-hand corner of each table where you can get this information filled in. So as you know it, when you get that information from the family, come back, get these filled in, and then can go from there. So check off all that apply, and then you'll see we've got that in the table. Moving down to guardian demographics, it will ask per guardian. For reporting, really just the primary guardian, but best practice would be to do an entry per guardian. So what is mom's employment status? We're going to say not employed. We can go back and then we'll do dad. We'll say full-time, 40 hours. So then you'll see we have an entry per guardian. So same thing with education, you would do that highest level of education, if they're currently enrolled, anything like that. You can get that added per parent. Housing, same thing. Even if the family lives together, you can do a housing status per guardian, and then military, and then if there's any other programs, you can also select those. Okay. As we move down into health information, so just a reminder, this is guardian health information. So insurance, again, we've got one per guardian. So making sure that just to kind of keep that in mind that it pertains to the guardian. Sometimes it gets a little confusing because you want to do it for the child or, but it could be that the family doesn't have insurance, the child does. So that's why it's kind of separated out. But you would do insurance, dental insurance. So again, do they have dental insurance per guardian? General health is just asking if there are any current diagnoses. Again, for the guardian, you would put that in. Tobacco use, emergency room visits, medical visits. So one thing with the medical visits, looking at prenatal and postpartum visits. So those go back to the guardian. So if you have a postpartum visit for mom, you would put that as a postpartum visit under mom. For the baby, that might be a well child visit or a checkup, something like that. But again, just kind of making that distinction of who is this visit for? So kind of the same thing. Prenatal and postpartum often just kind of gets confused, and sometimes that goes on to the child when really we're looking at mom for those prenatal postpartum visits. So just kind of keep that in mind. But if there are any medical visits or emergency room visits, you can get those entered. And then alcohol consumption. Now, some of these alcohol, tobacco, you may or may not see in your visit tracker. It really depends what outcome you are looking at. So on the affiliate performance report that you submit to parents as teachers, there's kind of those additional outcomes at the very bottom of the report. And depending which one you select. So there are, I think, one or two regarding tobacco use. If that is not an outcome that you are going to track, if tobacco use is not something you track within the family, again, under setup, that health info, you can turn those on or off. So again, just making sure that you only have the tables turned on for the data that you are tracking, just so that way there isn't confusion about, do I need to do this? Do I not? If it's there, it should be filled in. If it's not there, you don't need to worry about it. Okay. All right. Questions about the demographic information for the family? So that was all under demographic health. If we go to the child, so by clicking a name, that is going to take you where you need to go. You can also get to the children or to the child by clicking the children tab, and then we could scroll down to her name there. So either place will get you to the same place. Under the child data, if we look over on the left-hand side, we do also have a health info for the child. So there is some, the insurance information, the dental insurance, that also can be tracked here specific to the child. So you'll see we start with that question about delays or disabilities. That was asked when we added the child. If we need to change something, you can edit here. You can add a new. So if maybe down the road you do a screening, the child now is going to be getting speech services. You could go ahead and add that as a new developmental delay. Insurance history. So this is a big one for the child. You do want to make sure that you get this entered. So whatever insurance that child has, make sure that gets selected. Immunizations. So anytime a child has a well child visit or they go in to receive a new vaccine, you can go ahead and get that entered. And this can be approximate. So we don't have to know the exact date, but as of today, I know this child is current. So we can go ahead and mark that off. The rest of these are completely optional. Again, if you as an organization want to track when they received each vaccine, you can go ahead and do that. Otherwise, for PAT purposes for reporting, we just need this as of date. So as of today, I talked to the family, I know immunizations are current, and then we can say create. So you have that under immunization, child medical visits. So this is where if there's any ER visits, if there is a well child visit. So well child is another one of those additional outcomes. You would select whoever provided that, and then you would select it as a well child visit. So we have our well child. It's going to automatically kind of give me the age range that child falls in. And then we can say create. Again, if you don't know the exact date, that's okay. If we know around when that happened, that works just fine. Breastfeeding surveys, so children under 12 months of age. This is going to show up on the visit record, so we can fill it out then. Same thing with like medical visits and the safe sleep. I know this is one of your requirements for Ohio is to do the safe sleep. So we'll talk about that too. But you can either fill that in here or do it from the visit record. From the visit record is easiest because that's already when you're getting that information. So I'm going to show you what that looks like. But dental care, so does the child have dental insurance? Yes or no? Medical care, so where does that child receive their source of medical care? Can add that there. Safe sleep, again, is going to be on our visit record. So I'm going to show you what that looks like. And literacy activities is going to be on the visit record. So really from this page, it's the two insurance questions and the medical care. Everything else can be entered from the visit record. So you don't necessarily have to come back to this page. Only kind of that initial information on the insurance. Okay, so some of these other things with the child we're going to come back to. So we're going to go back to our family homepage. And then that is the bulk of kind of the initial entry of data. Are there questions about that, concerns, anything?
I don't think so.
Okay, perfect. So let's jump in now to adding a visit. So from our family homepage over on the left-hand side, we're going to click on contacts. And this is going to be all of our contact with the family. So from here, you'll see the plus icon in the upper right-hand corner. We're going to click on that. And then this is going to allow us to add those different contacts. So under contact type, private, the one right on top, that is going to be considered a visit. So anytime we are delivering curriculum content to the family, that is going to be a private contact. You also have the option of phone, text, email if you want to use this as your full contact log with the family. You can enter that phone contact and then in the notes what you all discuss. Same thing with text or email. There is also an option for other types of contacts. So maybe like an initial or intake where you're not delivering the PAT content. We're just going out to gather some information, maybe get some paperwork signed. You can put that in as an initial or intake. If you do some of that intake paperwork during your first foundational visit, go ahead and put it as a private. But just as long as you're delivering that content material. And then there's also no-shows and some cancels, which I'll also show you here in a second. If we have a visit scheduled and we have a no-show, we're going to talk about that. So for this one, we're going to go ahead and say we're doing a private contact. There is the option if you want to add a description, maybe you want to say that we're doing Foundational 1 in this visit, just a little synopsis so that way when you're looking at your contact log, you can just kind of see what is taking place there. The date and then the time. So again, the date, you can use the calendar or you can enter, if we do it on the 9th, you can enter it that way as well. So either way is fine. Same thing with the time. You have the option to use this little clock icon, or you can just type in, up to you. How long is our visit going to be? We're going to say 60 minutes. The home visitor, select the guardian, so who is going to participate. And then same thing with the children, if we're going to be providing that information for that child. And then location. So we're going to say the location is going to be in the home. And any additional notes. Location is also where you would select if you're doing a video conference, if you're going to do one via Zoom or maybe a telephone, which gets a little confusing because if you're doing that, sometimes people like to put this as a phone visit, but if you're delivering curriculum content, it's a private, and then the location would be your telecommunication. So select where that visit is going to happen, and then we're going to say create. So now on our contact page, you'll see we have our private visit scheduled. So this is where basically the log will be kept. It just keeps getting longer the more visits and contacts you add. So that's where that's listed. So from the contact, you'll see we have the date and the word private are both in blue. This is how we get to the records. So from the date, if we click on the date, that's going to enter our planning guide. If we click on the word private, that is going to enter the visit record. So we're going to start with the planning guide. We're going to click on the date. That's going to open up my planning guide here. And then just going through what we know from the PAT training, you're going to fill out your planning guide. So you'll see goals. If you had an open goal with the family, that would be listed here just so that you would be able to review that. Are you going to do any assessments or screenings? You can select whatever you might be doing there. Resource connection. So same thing as goals. If you had an open resource connection, this would just be a reminder for you to look at it, follow up with the family. If there was a referral from a screening, same thing. And then as we scroll down, so under the curriculum and handouts, if I select foundational, I'm doing foundational 1. that is going to pre-populate some information for me. So straight from the PAT curriculum, we have kind of created these templates for you so that way it just helps with time and you're not just copying and pasting, that it'll give you kind of those cues. If there's anything that you're not going to cover, but we had populated it, you can just highlight it and delete it. So you don't have to do it just because it's there. It's just what's recommended from the curriculum. Moving down to handouts. So the handouts will be listed here for what's recommended for that foundational one visit. Again, any handouts you're going to give in addition to, maybe you have a specific organization handout, something like that, that you provide the family, you can get that added as well. And the other thing with handouts is we have this little pencil icon that will allow you to actually check off the handouts. So if we open this, go to introduction. So here's our welcome to parents as teachers. We can click that. So you can check off the handouts that you're giving. And the benefit of doing that is it's then going to date stamp. So next month or in 2 weeks when I do the next visit, this welcome to parents as teachers handout is going to have a date next to it. So that way, especially when you're getting into activity pages, it's a nice reminder of what handouts you've given already, and then you know. So you'll see the welcome to parents as teachers is listed there. The other thing you can do with handouts is you can do a search, because we do know there are a lot of handouts. So if you just kind of type in some keywords, it's going to show you anywhere that is listed. So I can't remember what the handout was, but you can look for it there, check it off, and then that way you have it listed. I was going to try and see. Yeah, we'll just check off that one. And then we can save. So then you have your handouts listed. You can, continue to add whatever you need there. If you're doing a secondary curriculum, something like the foundational 2 or anything like that, add that there. Then you have your parent-child interactions. So a lot of these are just check boxes you can open, check them off. Activity pages. So this is where you can add your activity page. And again, by checking that off, it's going to date stamp it for us. So we'll have that date stamped. Prenatal. And we'll check that off as well for our prenatal baby. Parent educator resources. So if there were any resources that you used, and again, a lot of those are in the curriculum that will tell you which resource to use. Book sharing, supplies, moving down to developmental centered parenting. Excuse me. Key points, handouts. Sorry about that. Family well-being section, you can fill that one out. And then you have your closing. At the very bottom, we have our I don't know why this is saying this child is prenatal. We'll have to look at that. But if you it should say the age of the child listed there. You would kind of pull up, look at their milestones. Zoom won't show the milestones because they're in a pop-up window, but you would look at their milestones. And then at the very bottom, it's going to ask you if that planning guide is complete. So we're going to say yes, and then we're going to save. You'll see it's going to date stamp that I have completed that, and then we can go ahead and close. So now you'll see this planning guide date is in green, and green means it was saved as completed. If I opened this and started it, but I didn't complete it, so maybe I went in, filled some out, I need to go back to finish it up, you're going to see it in red. So red means this record has been opened and started, it just hasn't been marked complete. So as long as you've gotten it all filled out, we're going to say save as completed, and then make sure everything's green. Really quick, I want to go look at my child and see what is going on with this. Okay, let's go back to contacts. And then, so once we have our planning guide filled out, we go out with the family, we do our visit, come back, we're ready to fill out the visit record. We're going to click on the word private for that. So we'll click private. That will open up our visit record. So you'll see here we have our time, our location, who was present. So we're going to say mom and dad were both there. Stressors, how did we check in? And then do we have a next visit scheduled? So you can do that straight from your visit record. We're going to say schedule. And then, so we've got our next private, and maybe we're going to go out in 2 weeks at the same time. Check off our guardians that are going to participate and our children. Location is going to be home, and then we can say create. So now that next visit will be on the calendar. We don't have to do anything with that. So it's listed there. You will see some of the information from your planning guide did come over to the visit record. So you're not having to copy and paste any of that. It's already here. If something changed and maybe you didn't get to a handout, we can open that, and then we're going to do lock, play. Maybe we didn't do that handout. So I'm just going to uncheck it and then click save. And then that way it's still keeping a tally for me. So I still know what handouts I've given. So next visit I go out, I can do that handout. So you can change those handouts at any time. As we scroll down, so here's our overview notes. And then you can just kind of add. So it's just kind of a nice reminder of what you were supposed to discuss with the family. And then you can add your notes about what you discussed with the family. Child welfare, if you have this turned on, you would see that. Basically, if the family is involved with child welfare, you would select that. Goals. So if you set any new goals with the family, you can do that straight from your visit record. So we would click on the add button, and then this will allow us to add a new goal with the family. So the goal date is going to be the date of the visit. What is our anticipated achievement date? Oh, is that my problem? My date is off. Sorry, I'm in 2025 for some reason, not 2026. That's why that child was showing up
I
prenatal.
noticed that. I didn't say anything because I didn't know if it mattered.
No, it does. It does matter. Let me, yeah, how did I get there? I was messing around with dates. That was throwing me off. Okay. We're just gonna resave that. So now we're gonna look right. Okay. All right. Sorry about that. Okay, so now when we add it, now we've got the right date. And our anticipated achievement date is going to be a year out. But if it is a shorter term goal, maybe it's a 6 month goal, something like that, you can change that anticipated achievement. Maybe it's only a month long goal. So make sure that anticipated achievement date is set correctly. Who does this pertain to? We'll say the family. What is our goal area? Um, whatever the goal area, and then what is our goal. So then you would go ahead and type out the goal. The status of this goal is just going to be in progress because we've just started the goal. So it'll be in progress. And then we're going to leave the end date blank because we don't have that yet. What are our steps? Who are our people that need are people that need to be involved, and then any challenges. We'll go ahead and say create, and then we can close. So now we have this progressing goal. It is going to show up on every planning guide, every visit record. So as you're making steps to achieve this goal, you can add progress notes. So this little plus will allow you to add a note. How are things going? What are we doing? So each time you make a note, and then when we're finally ready to say, yes, this goal has been achieved, instead of clicking the plus icon, we're going to go back to the pencil icon. So we'll click the pencil. Here is our goal. And then we're going to update our status of that. So, what is the outcome? Did we abandon it or did we achieve it? And then, what is our actual end date for this goal? So, whenever that goal was achieved, go ahead and put that end date, and then we can click save. Now, this goal is going to drop off of my visit record because it's no longer in progress. Only those goals listed as in progress will show, but we can always find them under this goals and plans on the left-hand side. So that is where we would see our full list of all of our goals. You can add as many goals here as you need to, as many as you have set with the family. Just keep them running, make sure you're adding progress notes, and that is good. For parents as teachers, every family needs to have at least one goal per program year. So starting July 1 of 2025, we need to have every family that has a goal. Now, goals will carry over. So if you set a goal maybe June of 2025 and it was progressing into this current year, that goal will still count. So as long as there is an open goal for the family during the year, that is what we're looking at for parents as teachers. Okay. At least one goal. And then moving down, we have resource connections. So again, one resource connection per family per year. These do not carry over. So if you provided a family with a resource connection in June of last year, it just was resolved in July, that doesn't count. There does need to be a resource connection with a resource connection date this program year. Okay. So whatever resource we provided with the family, again, who does it pertain to? Is this a referral from an assessment?
Recording stopped.
Oh. From an assessment, and this would be different than a screening. So this is a parent assessment, a depression screening, IPV screening, something like that, not an ASQ or the health record. That's going to be somewhere else that I'll share with you in a minute. This is specifically looking at a parent assessment. So if maybe you did like an EPDS that you're making a referral on, you could do that there. But otherwise, we'll say no. What is our connection type? Whatever the connection type is, connected by, where did you connect to, and for what reason? Permission to exchange. So if maybe you did that EPDS and you wanted to share that assessment with the doctor, do I have permission to exchange that information? Yes or no? Otherwise, it would just be an NA. Any additional comments? And then you have two options here. So one is progressing. This is going to continue to show on my PVRs. So maybe there is some additional information I need to get from the family. Did you make that call? Did you go? Did you get in? Did you qualify? Whatever the case may be for that resource connection. Or is it already completed? Maybe I brought books to the family, diapers to the family, formula, something like that, where there really is no follow-up because I already know you got it. So we can go ahead and say that was completed. But if it is something where we do have a little bit of follow-up, then we're going to say progressing. We'll say create. And then it will show on our visit record, our next planning guide. So that way, again, it's a reminder for us to follow up with the family. Did you make that phone call? Did you get in? So you can do that. And then just like with our goals, you have the option to add some progress notes. So mom made a phone call, mom didn't call this week, is planning to call next week, whatever the case may be. So you can add your progress note. And then when you're ready to kind of close the loop on that resource connection, we're going to do the edit pencil. So just like we did with the goal. And we're going to say this connection is closed. So we're going to complete it. And then what was our outcome? So what is the new status? We're going to click on that and then it'll give you some options. So yes, services were initiated. Family declined. They didn't qualify, whatever the case may be. So you can select that as of what date, add an additional progress note if you need to, and then say create. So now, again, you'll no longer see that resource connection because we've resolved it and we put that it was completed. But over on the left-hand side under resource connections, you'll see that full list of all the resource connections for the family. Okay. So again, one resource connection per family per program year is needed. Moving down to family assessments. So you have your list here of different assessment types. Anything you did with the family, you can go ahead and check those off. And then we can use this blue plus button to add those. So this is where you would add your EPDS, I think the home that you all use. And we can talk about what other assessments, but the LSP, depending what assessments. All the assessments are listed here, so that's where you would find them. When you click this plus button, it pops assessments open in a pop-up window, which Zoom doesn't show you. So we'll talk about what that assessment page looks like in a minute. But just know you can do that from here. Next steps, get those filled in. Here's our activity pages, parenting behaviors. Again, that all transferred from our visit record. Here is our literacy survey. So how often or is a family member reading? Yes. How often? How many days per week? Safe sleep. So I know this one is a required one for you all. This will only show for children less than 12 months of age. And so you can just get that filled out. It will show up every time until the child turns a year. So you can go ahead and get that filled out. And then any additional comments, observations, developmental centered parenting with your observations, family well-being, medical visits. So again, this is guardian medical visits. So here is that one that I added from the health info page, but you can also just add that straight from here. So you would get those visits added. If you're doing the tobacco, here's that tobacco survey again. Individual child section. So here is where a screening, asking about if you did a child screening. So this is your ASQ, your ASQSC, your PAT health record. So again, we can add that straight from here, but it's going to open where you can't see it. So we're going to talk about that in a minute. You can check off if you did any of those screenings. Are there concerns about the child's behavior? Any reviews? Here's your milestones. Again, we'll talk about that in a minute. And then breastfeeding. So the breastfeeding survey, again, this will show up for children under 12 months of age that have a yes. Once you say weaned or stopped, this would drop off the record. So it'll no longer show. You would go, to that child health info to see the full list or add any additional entries that you wanted to do. Here's our child medical visits. So if you have your well child visit, you can do that from here. Here is our little prenatal baby. So you could type whatever is needed. Additional notes about the visit. Was it completed as planned? And then is the write-up fully completed? Yes or no? By clicking yes, that is what date stamps it that this visit record was completed. It's also what's going to turn it green. So we're going to say save and then we'll close. So now you'll see we have both our planning guide, our visit record are both in green. We have this next visit that was scheduled that we opened from or added from our visit record. So you'll see that listed. So yeah, we'll show those couple other things, but any questions about the visit record? Lots of information.
I don't have any.
Perfect. Okay. So to cancel or reschedule. So I just briefly went into this, say I planned some of my visit here. I get a call from mom. We need to reschedule our visit. So what I'm going to do here, I'm going to click the edit button on the right. And then I'm going to change this to a canceled. So a couple different options. You have a no-show, you show up at the house, knock on the door, no one's home. Canceled by program would be if your whole organization is closed. Maybe there's a snow day, something like that. So the whole organization is closed for the day, canceled by program. Canceled by parent, parent calls, canceled by home visitor. I, as the parent educator, need to reschedule this visit. So we're going to say canceled by parent. And then it's going to tell me, hey, you have a record for this event. Do you want to reschedule? If I say no, that record, that planning guide that I worked on is gone. We cannot get it back. So if you see this notification, you definitely want to say yes, unless you want to lose that visit record. So then we're going to enter our reschedule date. Maybe we're just going to go out a few days later instead, and then we can click save. So now on our original date, we have our canceled, but then here is that planning guide that I already worked on, rescheduled for our next visit. So that is how you would do a reschedule. Okay. All right. So just looking at a few more of these left-hand options. Like I said, most everything is going to be done through your visit record, but here's where you can view a lot of that information. So here's our resource connection that we added. You can add another resource connection. So if you're not on a visit, maybe you sent an email to the family, you called them, provided them with that resource. You can do that straight from here. You don't have to do it through a visit record. You can print your entire page of resource connections or each individual resource connection down here. Goals page is going to look very similar, same kind of actions. You can add a new goal, you can print your goals, print one page, do all of that from this goals and plans. Assessments. So when I click assessments, this is the page that's going to open from your visit record. So you can do assessments from the visit record. You can do that from here. When we click the add button, this is going to show us any assessments that we have turned on. So Steve, you'll need to go through the setup if you haven't already, and go under assessments on the left under the setup, and then just check the ones to show that you all are using. We do have a lot of different assessments in here, as well as a few kind of generic. So I believe like the IPV screen, if we don't have the specific IPV screen that you use, you can just kind of turn on this general one to be able to at least get that information added. Kind of the same thing with like a general anxiety we have that you can, or depression screening you can add. So you can kind of look through those. So just make sure that the ones that you all are using are the ones that are set to show.
And this might be some of those questions I had for the performance measures report. That
yes,
why they're not happening or not being at least tracked as a tracker.
Yes, okay. Absolutely.
Yeah, well,
so this is this is definitely where, so when we're looking at the PMR, your initial FCA, your annual FCA, this is where that gets entered. So depending what tool you're using for your family-centered assessment, if it is the LSP, this is where that needs to get entered. So for newly enrolled families, this does need to be entered within 120 days of that first visit. So looking at enrollment plus the date of the first visit. And that kind of goes back to what I saw in a couple of your families where you have an enrollment date of maybe 2024, but their first visit was July of 25. So it's counting them as a new family because of that first visit. So I think with some of your families that have been with you all for a while, you need to go back in and enter those first visits. You don't have to do all of them, and you don't have to do the visit record. Just get that first private on the calendar, and that'll help. And then from any of those families newly enrolled for this program year, this date will need to be within 120 days of that first visit. So making sure if it was done maybe back in November, then you can still enter it and then just backdate to the date that it actually happened. So you would enter whatever information is needed. So this is the LSP. You've got all your scores here. You can go ahead and get those entered. Scores are optional. So if you have a hard copy of the assessment that you're keeping in a file, as an organization, you all just need to decide, are we going to enter all the scores? Are we just going to keep our paper copies? Either is fine as long as we have the date and the participants, kind of this top information, that's what we're looking at. Okay. So if we click create on that, and then we go back to our assessment page, you'll now see we have our LSP. So that all looks good. And this family would be counted as in compliance because it was done within the first 120 days. So depending on what tool you're using there, that would be, just making sure that it's a PAT approved assessment tool. And then you all also, it looks like you do the home. I'm not sure. We have the IT home and the early childhood home. And it looks like that's your parenting outcome that you all use. The Edinburgh, we have that one listed. Felt like you had another assessment that the ACEs. You all do that one for your Ohio requirements, looks like. So hopefully all the assessments are here, and it's just a matter of checking those off, getting the right date to make sure that those were done within the compliance timeframe.
So as you're training, I have my visit tracker open and I'm just looking through it, and I did see in the assessments tab under the setup, it looks to me like they're all checked already, except for on the fourth page, it has a developmental tools, and none of those are marked show. So I was thinking maybe the reason we were missing some of those is because they weren't checked. But I guess for clarity for us, if we uncheck the ones we don't use, then maybe it'll be less clutter in the screens.
Yeah. I know. Sorry, it's a lot for you to uncheck. We're adding a uncheck all button.
I mean, that's fine with me. I had just assumed they weren't even available. Maybe some of them, but
yeah.
But okay, we'll definitely. I already sent an email to the managers asking for all of our assessments, so we'll go through and we'll make sure to clean that up.
Perfect. Yeah, that'll help, because otherwise, when you click this list, and I mean, this one's even kind of long, but if you have all of you just scroll forever because they're all there. So it might be that staff is just, I don't know what I'm supposed to check. So that'll definitely help to get that list cleaned up. All right. So that would be all your assessments. That's under the assessment tab. Transition plans. So when the family is getting ready to transition out of your program, you would fill out this transition plan. So you can see, you can check on all of those. create that record there. Supervision notes. So as you all are doing reflective supervision, you can add supervision here. So whatever you discussed about this family, you would just fill out that supervision note. And I'll show you a little bit more about supervision as well. All right, so family data, that is most of what needs to get entered. Let's jump over to the child because there is a little bit of additional child information that needs to be filled out. The information record, so this is a PAT form. So just making sure wherever your funding comes from, state, federal, local, you can get that entered so that you know where your funding comes from. Child contacts, so you cannot do a visit record or planning guide from the child contacts. This is essentially just showing you the visits this child has participated in. So it's just kind of a quick glance. You don't really need to go here very often, but it is an option. All right, screenings. So this again will be the page that opens from your visit record. So this is how you would add a child screening. So this would be your ASQ, your ASQSC, your PAT health record that counts for the health portion of the screening. So to add a new screening, we're going to go the plus button in the upper right-hand corner. So you'll see we have our developmental, our social emotional. Here's our PAT health record. If you do additional screenings, like some programs have a spot machine where they're able to actually do a vision screening, you could add that. But everything you need is under the PAT health record. Those would just be in addition to. So for our developmental screening, we're going to click on that. So here is my screening date as of today. Next due, it'll default to a year out. But if you are a program that does screenings every 6 months, you can always change that next due date. Totally up to you. By clicking this little bell icon, that is going to add a reminder for me. So that way, when next year, this time around, on my welcome page, it's going to start to show that little Allie Jones needs her developmental screening. So those little reminders are helpful. So kind of make sure you're checking on that. Developmental screening completed. So we only count screenings that are yes, that are completed. So knowing sometimes if you go out and try to do a screening and the child is just having an off day, we didn't complete that, then you would have to go back, try again, and then that one would be the yes. So making sure that you mark it, yes, it has been completed. Screening tool is our ASQ3. And there might be some additional options on your visit tracker or whatever tool you use. You might use something different too. But under setup and then screenings on the left, you can select additional tools if there's something else that you use. What is our screening result? Was it a pass or a concern? If it was a concern, what area did we have that concern in? You can just kind of check that. If it was a pass, again, scores are optional. So as an organization, you all need to decide if you want to put all of your scores in Visit Tracker or have your paper copy. Totally up to you. If there was a concern, and we did make a referral, a resource connection based on this concern. Right underneath, it's going to ask about resource connections. So you kind of have two options here. One is the home visitor just going to provide some support. So, you know what? We were right on the edge. I am just going to observe. Maybe we're going to rescreen in 2 months. If that's the case, then yep, I'm going to provide support. Click create. If it's enough that you want to make a full referral, a resource connection to get further assessment, then we're going to say, yes, we made a resource connection as of our date. Who did we refer to? Depending on who you all refer out to. CSE. So we're going to refer to our early childhood special ed program, the reason, and then any additional comments. So again, you have those two options of progressing or completed. We're going to say progressing because I want that to show on my next visit record to remind me, hey, Mom, did you call? Did you make an appointment? Did you guys get in? What happened? What was our outcome? So the rest of this will all be just like a regular resource connection. So you can either come back to this screening page or from our family contact next time we go to open our visit record, you are going to see this under the screening resource connection. So you can add your progress note, you can do your follow-up, just like you did with the family resource connections, it's just tied to that screening. So that is how you kind of got there with that. So just knowing to make sure that referral is tied to the child screening. Okay, so here is our ASQ that we just did. It was marked completed, so it's going to be in this column. If we missed that little completed button up there at the top, and I say save, you're not going to see it listed here because it wasn't marked completed. So this is the column. So again, going back to that PMR, we want to make sure there is a screening for every child in this column, looking at our completed screenings. So to satisfy the developmental screening, we need to have a developmental and a social emotional. So we also need to do our ASQ-SE. So we're going to say, yes, we did that and we passed. So we're going to just say create. So now I have my developmental screening completed. That's going to mark off one. And again, if we have a newly enrolled child or a prenatal baby that was born in the program year, we need to have that 90 days from the first visit this child did. So making sure those due dates are that you know when those are due. So looking at that 90 days. So that is going to satisfy our developmental screening. To do our health screening, we are going to do a PAT health record. So we're going to open this up. Cinderella is our screener. Is this our first health record? Yes. We started today. Again, you have your next due. And then what date was this fully completed? Knowing this is a really long record and it might take 2 visits or 3 visits to get through it all, that's okay. So you can start it as of today. So I'm going to fill out maybe all this prenatal information. We're going to get that all filled out and maybe I'll do some of this health information. So this is just the record that's in the PAT curriculum. So if you have questions about it, revisit the curriculum to kind of go through it. So you would just fill out the information. We're going to say save, and then we can close it. So here I have the date of the screening. I just haven't completed it yet. So this table really is just kind of a nice visual to know if I've completed all of my screenings. So maybe I go back 2 weeks later, we go in and fill out the hearing section of this. So then I can fill out the hearing section and the vision. So once all of these sections have been completed, then at the very top here, we're going to put our date fully completed. So maybe I completed it a couple weeks later on the 30th. So those dates don't have to match, is what I'm trying to say. So just make sure the date fully completed gets put in. At the very, very bottom of this record, you also have your resource connections. So, was there a health concern, a hearing concern, or a vision concern? So, if maybe we had a health concern, we would say add resource connection, just like we did before. You would add your resource connection. So, depending on what the outcome of that health record is. I was jumping around and not saving anything. So we're going to save and close. And now I have my health record, health, hearing, vision. All of those have been completed. And my developmental screening has been completed. So this is what we're looking at to make sure we know all of our screenings have been completed. Okay. So if we continue on our left hand, you have some child assessments. If the child is listed, so when I did that LSP, I selected the child. So that's why it's showing up there. It's usually best to just go through this family assessment, but you can look to see what child is tied to those assessments. Health info we already talked about. And then here's your milestones. So when you select on the visit record, this is what will open. So again, this is straight from the PAT curriculum. So if you have questions, revisit the curriculum. But otherwise, you're just going to check off what you observed were emerging milestones, what have they achieved. It'll date stamp that for you. So you can just kind of read through those, check off, and then click save. So once you get all your milestones completed, you can do a print that gives just kind of a nice printable version if you want to give that to the family, the parents, so that they have those milestones that are all recorded. It's kind of nice. Okay, so that is pretty much all the data entry for families, parents, gardens, children, all of that good stuff. We do have a couple tools over here on the left-hand side to help keep some of that straight. So the PAT compliance page, this is going to tell us, first of all, is this family new, meaning they're newly enrolled this program year, or are they annual? So were they enrolled in a previous program year, just carried over? How many private contacts have we had? It's going to give you the visit frequency. So you know your target versus your actual. Because this family is newly enrolled, they'll have a target of 0. But as you go on with the family, and this again goes back to those stressors. So how many stressors? How long have they been enrolled? All of those things, it will work that out for you to tell you how many your target is, whether it's 2 visits or 1 visit per month. How many actual visits have they had? What is your completion? The goal is 75% or higher for PAT. So yes, this family is meeting the benchmark because we're at 100%. Family-centered assessment. So it's telling me they're newly enrolled. And yes, we completed that family-centered assessment. We did our LSP. Otherwise, this would have a due date out here telling me when my 120 days is due by. So you would see a due by whatever date if that wasn't completed. Goals, resource connections. Again, every family has to have at least one. So this family has one goal, one resource connection. So we're good to go there. So we can mark that off our list. And then it'll move into the child information. I don't know why. Oh, I think I messed all of this up when I got my dates confused. But same thing for the child, whether or not they're newly enrolled or not. And then whether or not we have a child visit scheduled. So how that would look for like an older family. So this is a family that's been enrolled since 2024. So it's telling me they are annual. So when you have an annual, we're just looking like our family-centered assessment. This one says no. So I haven't done an assessment yet for this family. So I need to go back to my assessments and I need to get that completed before the end of the program year. Visits, I only had 8 target, but I have 13 actual. So I'm doing pretty good with my visits for this family. So you can kind of use this page to see. So my child, James Potter, I have not done screenings yet. So again, I need to go look at this child, look at their screening page. Is it just because I haven't done it? Did I not get it entered? What is the case there? So we would look at that. So this is kind of just a nice page to be able to see where are we. These are all those performance measures. So everything that's on your PMR report is on this page. And ideally, we want everything to say yes. That would be the goal there. So take a look at that compliance page to see where you're at there. The PAT records. So this is just taking the data that's been entered and putting it into the PAT record, essentially. So you can kind of open it up, review the information, make sure everything is correct. If the family is moved, maybe you need to update the address, then you could get that updated. But the records do need to be reviewed and updated annually. So once a year, typically the beginning of the year, your program year, kind of look through this data, make sure everything is right. If something needs to be changed, get that made. Otherwise, if everything looks right, we can just say add item. As of today, I reviewed the intake, I reviewed information, I reviewed all of this information. It all looks good. Do we have a new signed participation agreement for the current year? Oh, you know what? Maybe I need to do that. So you can get that all entered and then, oh, yep. Okay, now I have this participation agreement. So that's kind of how you would track your PAT records, is by using this. And you will see it's on the left-hand side, but it's also across the top here when you're on the family homepage. Reminders. So if there are any reminders set for the family, you'll see those there. So those little check boxes with the bells, those are going to come here. You can also set reminders for the family. If you want to add a new reminder, you can do that. Data quality alerts, depending on what you have turned on, you might see that the family has some alerts. Just to let you know, some of these alerts look a little bit different than what PAT looks at. So some things like all of these employment, education, a data quality alert is going to look at the current program year. So do we have this entered? So you'll see this one says our last entry was 2024. So I would need to update that to the current program year to get that alert to drop off. But for PAT, we only have to have this entered once. And then after that, anytime there's been a change. So some of these alerts, if you're just specifically looking at your PAT data, you can actually turn those alerts off. So again, Steve, under setup and then data quality alerts. So you can kind of look through those and see what are helpful and what are not. So you can turn them on and turn them off. If you have questions about any, let me know, and I can kind of help you with those too.
Okay, I was just going to say, I think at a minimum, I just want to make sure that they have all the assessments and everything that they can get in the system or they need. And I just did go through on Visit Tracker while we're doing the training, and I went through and mapped all of our assessments out that we have. The only ones that I could not find are that we do a comprehensive, an infant health, a prenatal health, and a safe sleep. And Christine is on the call too, so she might be able to help out with this. But is there a different name or something that I need to be looking at for Visit Tracker for those?
So depending, like the safe sleep, that would be listed under that child, under the health information. So instead of that's the only safe sleep we have.
So I don't have to worry about that being turned on. That's automatic.
Right, okay. Right. And then we also have on like the infant health, I don't know like what you all look at specifically, if that could fall under that child health record with the prenatal postpartum section. There is also, we have a postpartum prenatal record for children entered prenatally. So that might suffice for your infant health.
So some of the questions for the infant health is like how much the baby weighs, when how many days is the baby in the hospital and the NICU, breast milk for their first feeding, and just those just general questions about the hospital. How much did the baby weigh? Is there anything comparable to that or close to that?
So I would say probably this prenatal postpartum record.
Okay.
Because that kind of has all of that information. If there's NICU, the birth weight, all of that. So I would say that should work for that.
Okay, thank you.
Yeah. So, and again, that's under a child that's entered prenatally. You'll see that prenatal postpartum record. If you need it on a child, like we had our little Allie Jones, all you have to do is enter a date, a due date, and then that will add that record. So if we put her due date in here, and then all of a sudden we have this prenatal record now. So you could fill that out for all of your kiddos. And then comprehensive, I don't know what you all would use for that. We might have to look at what assessments
That would be a Christina question.
I'm sorry, ask me that one more time. Somebody just knocked on that door. I heard you say that was a Christina question.
For comprehensive, what we asked
what
for.
What were some of the questions on comprehensive? That's kind of just it's a general employment, like it's employment, household incomes, if they're a student or not. This kind of helps with
so
the
kind
needs
of.
of the. I'm sorry. What did you say?
So kind of like just what we have under the demographics.
Yes.
Okay.
This is kind of identifying barriers of the family or things that we can help with. It goes over transportation, food, and things like that. If they have any assistance, WIC or SSI. So just kind of giving a general outlook on what they do have and, what we can help with.
Perfect. So yeah, I think it sounds like data that's already being entered. And then we have what we call like this family summary page that basically is all of that. So if you are needing to show like, yeah, we're collecting all that data, you could do this family summary page. And there's this report right here will kind of show all of that. So I think just by getting all of your data entered, you're satisfying that need. Perfect. Okay. So with the last little 10 minutes here, we'll try and go quick. So under your calendar, this is just kind of a calendar view of all of your visits. This is also where you would add group connections, your supervision, different things like that. So if we click on a date, you can add a group contact. So if you're doing a group connection, we would add that as a group. You can add the title, any notes, presenters, all of that information for your group connection. If we continue to the plan, here is our group connection plan that we would fill out all of that information for volunteers, materials, supplies, all of that good stuff. Once it's added to the calendar, you'll see that in light blue. To add attendance, you'll click this little blue person. That will open up so each parent educator can add their families to that, or a supervisor. If you've got the attendance sheet, you can add all your families. So save and close. We have our attendance and that. So you can get there from the calendar. You can also click on group connections on the left. And if we say display groups, there's all of our groups. Here's your plan. Same thing that we filled out before. And then the attendance. So again, that's where you check off. And then there is a record that can be filled out after the fact. So you can fill in the record. Here's some of our attendance. So you can fill that out. Supervision, calendar. Supervision is added as a staff event. So here is our staff event. You have individual or group. If we do an individual, you can add that as your supervision. So we would do a supervision, and then you'll also see we have observations, staff meetings, file reviews, advisory committee, all of those different things can all be added here. So who is our supervisor, supervision, and then click create. So supervision is on the calendar. It's also on the left-hand side. We can add that. Here is your record that can be added. So you can check off if any families were discussed. Maybe we talked about those two families. Check off anything else, and then add your discussion notes. When you save the record, this will take you to the supervision note that we looked at earlier on the family file. So you can click on that. Okay, and sorry, I'm going to go really quick with that because I do want to get to reports. So for your PAT reports, everything on this right-hand side is what you want to be looking at. So obviously you've looked at your APR, your PMR, anything on the PMR, anywhere there's a blue number, we can click on that. It's going to show us what families are out of compliance or missing. You also have some additional exports. So looking at your PMR, I think your biggest issue is that your enrollment date isn't always lining up with the first visit. So like I did one is just kind of an example. So we have Janie Smith here who has an enrollment date of 12/10 of 24. But when I go to her contact page, her first visit is 7/18 of 25. Because this is the first visit, this is actually a family that's counting as newly enrolled, because they didn't have a visit in the prior program year. And I know you all kind of started later too. So it may be that you just kind of said, okay, we'll just start entering visits as of the date, you started your visit tracker. But if I go back to 12/10 of 24 and just do a quick private contact, we're going to go 12/10/24. Select our guardian, select our child, and then location and say home. And so now that I have this visit added, it's now going to make this an annual family. So when I look at my PMR, instead of being in this initial pocket, they're going to be counted in retained annual because I've got this visit added. So when we look at the compliance page, we now say annual, where before I added that visit, it would have said new. Does that make sense?
So in essence, we'll want to go back and look for all of our prior enrolled families and make sure that we just have one encounter that matches that date.
Exactly. And then for your PMR, instead of having 0 here, some of these families are going to drop into your denominator. So that way they're just counted correctly. And then it'll be going back to make sure that assessments, did they happen? And then getting them entered. So like with this family, we can go back to an assessment. So I don't have a family-centered assessment entered. Maybe I did that LSP back in September. So just getting the date entered, making sure that when that happened, you get it, get that entered, we'll say create. So now this family that I've got, A, the right enrollment, and B, now we have this completed. So now they're going to show up as in compliance. So I think that's the biggest thing with your compliance issues right now is that that you have families that are annual that are actually counting as initial, and then just making sure that that gets entered. So the assessments, the screenings, things like that. And if you look also under reports, so we have these compliance reports. So the FCA compliance, your family-centered assessment, you have two ways of running this. If I do it by new family, that actually will give you due dates. So here's one that I pulled a little while ago, but it'll give you like as of February 27th, that was the 120-day mark for that family. So that way you can kind of see when exactly they're due by to make sure you're hitting that 120-day compliance and getting those entered. So again, hopefully it's just that staff didn't know where to enter those and that they've all been completed. And then once you start to get those entered, and then same thing with screening compliance, you have an initial compliance for those newly enrolled children that will show you that date where the child has reached 90 days. And then it'll just tell you yes or no, was it completed on time, or do we still have time to get that done by? So definitely look at those compliance reports. Those are great ones. The goals is basically just going to tell you, have they had a goal, yes or no? PAT compliance is they just have to have a goal within the program year. So making sure all family has a goal set, all families have a resource connection. Visit frequency, again, will kind of show you that target number of visits, how many visits they currently have. So like our Adams family, 16 target, 16 actual, we're 100%. So like this one that we're really, really close to that 75%, maybe we just need to get in one extra visit. So we can go back and look at the Brady family and see how we can get that. So look at those reports. Those will definitely help get you up to where you need to be. But I'm thinking a lot of it is just they didn't know where to enter those at. So hopefully after talking with staff, they'll know and they can get those all entered, and then you'll have a beautiful PMR. All right, I know we're past our time, but are there any other questions that you all have? The other thing I want to point out is under our support, and this is going to kick me into my knowledge base because I'm already signed in. Let me stop sharing for just a quick second while I log out here. Okay, sorry. Let me share again here. So when you open the knowledge base, this is kind of what you'll see. Under support outlines, we do have a whole home visitor 101, which is a lot of what we talked about today. So here's a whole kind of tutorial on entering your assessments. So that'll walk you through getting your assessment entered, getting your screenings entered, all of that good stuff. So that's all under the trainings and support, and then lots of different tools, different videos. So you can use the search, and then when all else fails, we do have a submit a ticket. So feel free to submit a ticket, ask any question. No question is a stupid question. So feel free to ask. If you do have a question about a specific family, so maybe like we were talking about this one that had kind of something weird going on, like we can't figure it out. Everything looks right. Can you look at this family? Instead of using the family name, if you will use this family ID number. So you can just highlight it, Control C, and then drop it. I've got so many tabs open here. When you do the submit a ticket, just paste it here and, family, whatever, question about their compliance, or, try and give us as many details as you can, but just use the family ID number instead of, emailing family names, just so that we can keep those private. And then if we need to, if like once we've got some training and you want me to look at your PMR again, just let me know, and I'm happy to kind of go in and look at some of those compliance things and see where else you might be missing some data entry on that. But yeah, we can definitely take a look at things as you all get going. And then I will finish this up and send it back to you, so that way you have where all of that gets entered as well.
Yeah, that would be wonderful.
Perfect. Do you all have any additional questions? Anything else I didn't cover that you wanted me to touch on?
I do not. I don't know if anybody else on the
call have anything. No, I don't have anything.
Just to verify, this is all a training environment, so none of this information is HIPAA that we need to worry about if I recorded this.
Oh, yeah. Okay. No, this is all fake.
Okay, good.
Yeah, yep. Fake families.
Just wanted to verify.
Yep. All good. So yeah, definitely share. And then, like I said, just follow up. Let me know if questions come up. If you still can't quite get that PMR worked out, we can plan, a time to kind of meet and talk about what else needs to happen to get your numbers up to where they need to be.
This is the demo mode, is that right?
So this is like my training account. Okay. But we do have a demo account. So if you go to visittrackerweb.com, before you log in, if you click the demo up above, it'll just ask you for some quick information. And then you can go to an actual demo account and play and look. And so that demo is available to you at any time. Feel free to use it. Just know it is a public demo, so don't enter, real information.
Right. I know they had us kind of doing this before, so some of those names and things were kind of, really funny. But it's something. It's something that we can probably use to kind of, like you said, play around with. So I didn't know if you were in that mode or not, because it kind of looks the same.
Yeah, it's exactly the same. It's a fully functioning demo that looks just like your visit tracker. So you can definitely use that.
Okay, thank you.
Perfect. All right. Well, if there are no other questions, I'll let you all go for the day. And then, Steve, feel free to follow up if things, if your numbers aren't turning around the way we want them to. Let me know, and we can plan some additional time to discuss that.
Okay, Jen, I appreciate it. Are you going to send me that updated ODH or DCY chart too?
Yep, I sure will.
Okay. Thank you very much.
Perfect. All right. Well, thank you. You guys have a great rest of your week. And
You too.
I'm sure we'll be in touch.
Thanks.
Thank you.
All right.
Goodbye.
Thank you. Bye.